Hi again, everybody. We're getting right into the spinal cord in this next video. And so this is a cross-section of a spinal cord. What I want to have you focus on really quickly is that whereas in the brain, the outer region was the white matter and the inner region was, or the outer region was the gray matter and the inner region was the white matter. Here you can see the outer region is the white matter and the inner region is the gray matter. It's always important to recognize that, and you can see that it's like you have two anterior horns and two posterior horns down here. So you have dorsal and ventral horns. You have these lateral horns that stick out onto the side, and then you have this white matter that surrounds all of that. So what's the function of the spinal region? The dorsal portion here pulls in sensory information from the peripheral nervous system. So it's going to pull in information like temperature changes or changes in stomach distension, stuff like that. And then that information is going to move up into whatever region of the brain we need it to move to. If it's something that we need to be consciously aware of, it'll go to our cerebrum, and I'm just moving it here. This is the spinal cord as well. If it is something we don't have to be aware of, it might go to the medulla or whatever region we have to move it to. And then the anterior horns up here are going to take and send out motor responses to the PNS so we can bring about whatever change we have to. The spinal cord itself does not run the entire length of the the vertebral column. It stops, so it only grows until we are a couple of years old, and then the rest of the growing occurs as the nerves keep extending, getting longer and longer. And what this does is it actually forms what looks like a nerve tail that looks kind of like a horse's tail, and so it's called the cauda equina because it looks like that horse's tail. There are four major regions of the spinal cord. We have that cervical region. Within that cervical region, multiple nerves are located. And this is known as the cervical plexus. One of the major nerves that I'll talk about is the phrenic nerve. Then we have the brachial plexus, first part of that thoracic spinal cord. There's a lot of nerves there that I'll be talking about as well. And there's more nerves than what I talk about. I just only care about certain ones. There's a lumbar plexus, and then there's a sacral plexus. There are 31 pairs of spinal nerves, but you're only going to have to know a few of those nerves, which is kind of nice. So the blood supply to the brain and spinal cord, well, to the brain mainly is what I'm going to look at. The brain needs to have a continuous blood supply. We have very protective blood-brain barrier that protects the brain from any potential damaging or pathogenic agents. And the blood-brain barrier, it consists of the continuous capillaries that are super tight, as well as astrocytes that wrap around the neurons and keep materials from getting in. But we have to have a good blood supply as well, and because of that, we have a special anastomosis that brings blood and circulates the blood throughout the brain. This anastomosis is known as the circle of Willis. We'll learn more about it when we talk about the cardiovascular system as well. But the circle of Willis is made up from anterior cerebral arteries, middle cerebral arteries, and posterior cerebral arteries. Blood comes in from the internal carotid artery that brings blood into the different regions. The vertebral artery also brings blood in to the region. Blood moves through this basilar artery and helps in forming that anastomosis. So we have this great blood supply that's constantly supplying all of our brain regions so that we have the ability to keep our cells functioning. That blood has to drain, so once we give the good nutrients and we take away the waste products, that blood drains through multiple sinuses. So you have a superior, inferior sinus, a straight sinus, transverse sinus. All of these sinuses together make up what we call the dural venous sinuses. And these sinuses all drain into the jugular vein, internal jugular vein. So the internal jugular vein then sends the blood out and into, eventually, the brachiocephalic vein, which will then dump into the superior vena cava and get reoxygenated. We have 3 meninges that help protect our brain and spinal cord. These meninges, so these same meninges wrap around not just the brain but also the spinal cord. We have the dura mater, which is the outermost region. We have the arachnoid mater, and then we have the pia mater. Pia mater is attached directly to the brain, and the arachnoid mater is in between, and then the dura mater sits outside and protects the brain. And I just told you the 3 layers, so there they are. Each of the layers functions in helping to allow cerebrospinal fluid to flow through and helps to protect and keep the brain from getting hit or damaged in any way, shape, or form. A couple of disorders associated with the meninges. An epidural hematoma occurs when you have blood pooling outside of the dura mater. So if something happens, you have a severe blow to the head and a blood vessel ruptures, you can end up having an epidural hematoma where you have a lot of blood outside of that dura mater, between the dura mater and the actual cranial bone. This can compress the brain and cause damage to those neurons and the nerves. So treatment is typically drilling through the bone to release the blood, and then you fix those blood vessels so that they can, they stop bleeding. Subdural hematoma can be even more dangerous. Subdural occurs between the arachnoid mater and the dura mater. So when the subdural hematoma occurs, it's usually not seen as quickly. It usually starts with someone, having a headache, having pain, and then eventually can lead to death or, brain damage first, and then death if not taken care of. But it's not as quickly noticed because you're bleeding slower, so it's a smaller space. So this oftentimes, again, could be associated with like whiplash or some other severe damage to the head. This, you'd also have to drill through the brain, cut through that first meninge, and then you'd have to drain that fluid and fix the damage. Meningitis then is inflammation of the meninges themselves. So if the meninges are damaged due to bacterial or viral infection, that can lead to meningitis. So the first symptoms of meningitis typically are a very stiff neck, fever, and it can come on very suddenly and can lead to death if not treated. There are vaccines that treat for the most common types of meningitis, and most people, if they are going to be in a dormitory or anything like that, crowded area, they're going to receive that vaccine so that they are protected from this disorder. Bacterial is very serious, but is easier to treat than viral meningitis. Viral can, in both cases, when you have meningitis, typically you're in the hospital and they're going to be monitoring you very closely. So, talked about cerebrospinal fluid a little bit earlier. I said cerebrospinal fluid circulates through, I don't think I said it in this lecture, but I've said it in the past. Cerebrospinal fluid circulates through those meninges. The ependymal cells help to form help to form cerebrospinal fluid and help to move the cerebrospinal fluid around through those meninges, through the different brain and spinal cord regions. So cerebrospinal fluid in a nutshell, or CSF, is a colorless fluid that is formed it's formed from, or by the ependymal cells, and it has three major functions. It helps to protect the brain, keep it buoyant in that cranial cavity, keep the brain from hitting the cranial walls, and helps to maintain the electrical balance of the brain. So I told you, so buoyancy, if the cerebrospinal fluid was gone, then the brain could actually shrink up and it could actually fall through that spinal canal. So that's really important, that we want to keep that brain hydrated. Protection, I mentioned that. If your brain moves too fast, it can actually cause damage to the brain in the different regions when it hits that cranial cavity. And then providing environmental stability, so chemical stability, basic electrolyte balance within that cranial cavity and spinal cord. So the choroid plexus is where cerebrospinal fluid is produced, and it's ependymal cells that make up that choroid plexus. The solution is made from blood plasma, so it has a similar composition to blood plasma, and moves through the brain, and then it can leak back out into the blood plasma, and we can produce new when we have, CSF that has materials that we don't want in it anymore. We can give that material out. So we're constantly producing new. We want to get rid of the old. And that helps to maintain that chemical environment. Oh, I will mention, a lot of you have probably heard of the term water on the brain. This is when the CSF is being produced but can't drain properly. And this can cause a disorder known as hydrocephalus. Hydrocephalus then can lead to brain damage and death if not treated. We see it in infants, and their brain or their skull tends to swell up, and that's because their soft spots, those fontanelles, are not fused yet, so their skull can open up a little further without damage to that brain. Now we're going to look at the different nerves. A nerve itself, we talked about in the last chapter, is organized very similar to muscles. A nerve has multiple neurons and axons associated with it. A fascicle of neuron axons, or a group of neuron axons, is known as a fascicle. And then each individual axon itself is separated from the other ones by a tissue called the endoneurium. The fascicle is separated by a perineurium, and the entire nerve has an epineurium, very similar to that muscle. We have 12 pairs of cranial nerves that you do need to know. Each one has specific functions. Some have multiple functions, some have only one function. You want to know for each nerve that is a cranial nerve, the main, so if they are sensory, motor, or both, sensory and motor, and what function they have. If they are both, give me a function for each. If they are motor, what's their motor function? If they're sensory, what's their sensory function? So when you look at the nerves, they are listed as cranial nerve 1 through 12. And you want to know these nerves by their actual name. So if I say name cranial nerve 1, you'd say olfactory. If I say name cranial nerve 5, you would say trigeminal. So that's kind of how it works. You also want to know sensory, motor, or both, and there are some different mnemonics that you can use for those who like mnemonics. The one that I learned was O-O-O, I should say O-O-O, to touch and feel very good velvet. Ah. Oh, so very good, I should say good velvet. Ah, so it goes down, sorry. That's how I learned them. And then I also learned my mother, some say marry money, but I want to make sure I'm doing it right. Some say marry money, but my mother says bad business, marry money. And that helps you with that sensory, motor, or both. So some, olfactory, is sensory for smell. Say, optic, is sensory for sight. Marry money, oculomotor, is motor for eye movement. Trochlear is motor for eye movement. But trigeminal has both motor and sensory. So you can just go through and figure out what their functions are. In the book, you have a table that has all of those functions in there. And then I told you before that there are 31 pairs of spinal nerves, but you only have to know a few of those nerves. The ones that I have listed are the ones that I'm really going to be focusing on. Cervical supplies the head and neck, and the diaphragm. And the phrenic nerve is the one nerve that I really care about in this group. Brachial supplies the arm. I'm going to mainly focus on these two nerves, the ulnar and the median. There's other nerves. I mean, there's lots of nerves, but these are the two I want you to focus on. Phrenic nerve stimulates the diaphragm to breathe. The ulnar nerve is the nerve that causes serious pain when you hit your funny bone. It's what gets compressed. The median nerve is the nerve that runs through your hand, or that gets compressed, I should say that, in that carpal tunnel when you have swelling. And that's what causes the carpal tunnel syndrome, because you have compression of that median nerve. The lumbar nerve supplies the anterior leg, containing the femoral and obturator nerves that stimulate that anterior leg. I don't tend to ask a lot of questions about those, so I probably won't. But then the sacral nerve supplies the posterior leg, and the major nerve that I like to always talk about is that sciatic nerve, because that's probably the most common nerve. Most people know that nerve. It causes a lot of pain when compressed. And I am done with this lecture, so I'm going to post this video, and I will start the next lecture in a little while. Bye.